mental health challenges among firefighter cancer survivors. So today presenting is Dr. Kellie O'Dare-Wilson. She's a researcher, educator, and advocate with expertise in first responder health and wellness, health policy, and organizational resilience. As the founder and director of the Second Alarm Project and research associate professor at UCF Restores, she has led initiatives to improve the mental health and resilience of first responders and their families. Dr. O'Dare has secured over $8 million in funding for her impactful research and is personally connected to the first responder community through her late uncle, Sean T. O'Dare, a firefighter paramedic killed in the line of duty, and her husband, a current firefighter paramedic. Please welcome to the stage, Dr. O'Dare. Thank you.
Good morning. I wanted to just take a quick moment to thank University of Miami, the Sylvester Center, and the FCI for having me here today. I was so excited and encouraged to see mental health on the agenda and that we're having these conversations a lot more, because I think that there's so much interconnectedness in these two topics, and I'm very encouraged and excited about steps that we can take in the future to do some more research. As the gentleman was pointing out in the audience just before I came up, there's not a lot of existing research about the intersectionality between mental health and cancer, and I think that in firefighters. So I think that there's a lot of opportunity to do some good work here. As Dr. Sully mentioned, I'm Kellie O'Dare. I'm a faculty member at University of Central Florida with UCF Restores, and I'm also the founder and the director of the Second Alarm Project. UCF Restores is a national leader in trauma management, providing evidence-based treatment for PTSD and other mental health challenges, while training peer support specialists and also a proficient mental health workforce for first responders. The Second Alarm Project provides a focus on enhancing the behavioral health and resilience of first responders through comprehensive programs, peer support training, and innovative resources tailored to the unique needs of the public safety community. And I wanted to just take a minute to talk a little bit about how I got into this work. As Dr. Sully said, working with first responders and the fire service in particular is deeply meaningful to me. I am married to a career firefighter paramedic, but I am also a line of duty death family member. My uncle, Sean O'Dare, was a firefighter who gave his life in the line of duty right here in Miami-Dade County, rescuing a child trapped in an automobile submerged in a canal. So part of the reason that I do this work is because I understand the sacrifices that the fire service makes and that is on fire service families. And I got started doing this work probably about 8 or so years ago with first responders specifically, because one of my husband's fire chiefs at the time, when I was a researcher at University of West Florida, came to us and said, "Hey, do you guys know anything about this whole PTSD thing?" And we said, yeah, we know a lot about PTSD, but we don't know a lot about PTSD and first responders. It was really kind of the dark ages of this work, and we're still very much in its infancy, but it was really new at that time. And so as good academicians and good researchers, what did we do? Well, we started doing research. And what we found was really just appalling, honestly, and it kind of moved us to say we need to do something about this. And I'm not going to talk a lot about our research and our findings today, but we were finding things like 30% of our first responders would screen in for probable PTSD, 15% at higher risk for suicide, issues with substance misuse, depression, anxiety, really across the board. And I found myself, in front of a room full of white shirts with a lot of bugles and bars and stars on their collars, giving these results. And what we didn't have were a lot of solutions. And I didn't feel that that was adequate anymore. So we went out and we got our first federal grant to do this work, to link in some solutions. And that was back in 2019 when the Second Alarm Project was born. And we really started doing work with the first responder community to be strengths-based and solution-focused. And so when I was asked to do this presentation today, I kind of dove back into the literature because while I know an awful lot about mental health with first responders, I don't know a lot yet. This is new for me, the intersectionality between mental health issues and cancer. And what I can tell you a lot about this morning is that we don't know a lot about that topic. It's a huge opportunity for some growth and for some further research. There is a good body of science, a good body of literature out there about cancer survivorship and diagnosis and treatment and the general population. But I really didn't find much about first responders and about the fire service in particular. So I'm really looking forward to being able to do some more work in that areas. So as we know, and as we've been discussing for the last couple days, firefighters face an increased exposure to cancer. Many firefighters and their families adapt, find purpose, and become advocates. And so I don't just want to talk about the concerns and the challenges today. I also want to talk about the strengths that are inherent in this community that makes things like resilience and post-traumatic growth after a cancer diagnosis, after cancer treatment, after remission and recovery, and into survivorship. So I broke down the points that I want to talk about today into these 5 different categories that follows the cancer journey, looking at risk, diagnosis, treatment, recovery, and survivorship, and some of the mental health challenges that individuals might experience in each of those different areas. Understanding and addressing these challenges really does improve well-being and recovery, and so the better that we can become at supporting our fire service members as they're going through the cancer journey, the better off they will be and their families as well, which I'm going to talk a little bit about towards the end of the presentation. You know, I've been also really excited and encouraged this morning hearing every presenter that we've had prior to me coming up here talking about their family and the importance of their family and their grandchildren and their spouses and their children. And so we're really remiss if we do not look at the impacts that cancer has when a fire service member is diagnosed and treated, what impacts those have on the families and how we can better support the families. So at some point in their career, probably early on, hopefully early on, more early on now than has been historically, a firefighter realizes that they're at an increased risk for cancer. And this can come along with it some mental health concerns. They can have health anxiety, either symptom vigilance or avoidance. They can become hyper aware of their symptoms or potentially avoid screenings due to fear of diagnosis. The unknown risk of developing cancer can really cause a lot of distress. Some firefighters might also have guilt or remorse that they may not receive a diagnosis of cancer, whereas some of their brother and sister firefighters may. When a firefighter is diagnosed with cancer, there can be shock, fear, and uncertainty. It really is a life-altering impact. It can be devastating, or for some, perhaps it might bring closure to signs and symptoms that they've been having, and getting that diagnosis may be a relief. A cancer diagnosis can really challenge our sense of invincibility and raises mortality awareness, and that can be challenging for a first responder, for somebody in the fire service. Concerns about how this diagnosis will affect their loved ones, their peers, their family members, and worry about career impact and workplace reactions. During treatment, it brings a whole host of emotional and psychological concerns. It can be draining, both physically and emotionally. Firefighters may feel vulnerable, frustrated, and disconnected. Physical limitations and stigma may lead to isolation. Job uncertainty and medical costs can also add to the burden. Financial concerns are a big issue, a big concern. Treatments can be exhausting. They can cause brain fog and reduced or impaired brain function. And during these times, peer support and mental health resources are critical. And what we hope is that ultimately we're going to get our fire service members to recovery or remission, although having a potentially terminal diagnosis is also another consideration psychologically in working with individuals who might not get to this stage, who might be facing a terminal cancer diagnosis. How do we better support those individuals? But for those who move through to recovery and remission, they may be concerned about reoccurrence. There's a lot of anxiety. There can be hypervigilance. Returning to work can be overwhelming. Returning back into the family environment can be overwhelming. Confidence in their physical abilities may be reduced. Cancer can reshape our personal and professional identities, causing disconnection in both workplace and the family life. Can have severe strains on relationships. And lingering fatigue, pain, and cognitive issues can impact daily life. During survivorship, fear of recurrence can be persistent. That anxiety sort of hangs on. Is this cancer going to come back? Lasting physical and cognitive effects, lasting identity and role shifts, emotional highs and lows, gratitude and resilience for surviving might coexist with anxiety and depression. More reintegration challenges both in the professional sphere and in the personal sphere. Survivor's guilt can be common, may be common, guilt over surviving while others did not. And an existential reflection. Cancer can really spark some deep questions about life's purpose and priorities. So what we see is a fairly heavy emotional, psychological, and mental burden throughout the journey through cancer for a firefighter, all the way from learning about their risk through survivorship. So how does this impact families? Emotional and psychological strain happens on the family members as well. They can be filled with fear and anxiety. The caregivers in the family can become burnout. There's increased stress and role shifts. What used to be done together might now rely on one individual and not the other individual while they're very ill or receiving treatment. This can impact children as well. Children may have some secondary traumatic stress going on due to what their parent or caregiver is going through. Families may struggle with guilt when others are less fortunate if they have a survivor in their family, but perhaps somebody from their fire department did not survive. And it really does strain relationships. There's also financial and logistical challenges. Again, big financial strains can come along with a cancer diagnosis and treatment and being out of work. Navigating benefits can be tremendously challenging. Anybody who's tried to navigate cancer benefits know how challenging it can be to access firefighter-specific aid sometimes. Work and caregiving balance, spouses may need to adjust their own jobs, their own careers, request their own leave time. And housing and travel stress, specialized care may require relocation or long commutes. Okay, as I mentioned, I don't want to just talk about the challenges or the concerns associated with this, but also where are the strengths? What can we do to help assist these firefighters and these families? I'm a huge proponent of the concepts or constructs of both resilience and post-traumatic growth, and I think those are both really important because they're inherent traits in a lot of first responders, particularly in the fire service. They come into these problems and into these challenges with a background and a skill set that differs them a little bit from your other occupations and other professions. And we really need to leverage that to be able to support these individuals and their families. They're mentally tough. They're adaptable. They problem solve. There's a strong brotherhood and a sisterhood in the fire service that we can leverage that can be a tremendous strength. Many, not all, we hope that it's becoming more frequent that they're really committed to wellness to begin with. And they're also used to overcoming setbacks. So all of these things can be a tremendous strength. Post-traumatic growth is some work out of Dr. Richard Tedeschi and his colleagues, and I believe it serves as a great foundation for looking at these challenges head on, whether it be a diagnosis of cancer or a diagnosis of PTSD or really any challenge that we may face in life. And it's based on 5 fundamental phases that you can move through and achieve growth in after something like a cancer diagnosis. You have the ability to get a deeper appreciation for life. You have the opportunity to strengthen your relationships. You may arrive with a new sense of purpose. You have some increased emotional depth. and also the opportunity for spiritual or existential growth. What we frequently see as well is the opportunity for individuals who have survived cancer, and we've again seen that over the past couple of days, to come back and make sense and purpose out of what they have been through to help others. So they become advocates and they become leaders in the fire service. They become a mentor to others who may be undergoing these challenges. They start to bring more cancer awareness and prevention efforts into the community. And they really start to improve the fire service culture. And that's a big piece of what we've been talking about here this week, is improving or changing that culture in the fire service. How can our families become more resilient and achieve that post-traumatic growth? We see that stronger family bonds may emerge. We see a stronger level of support from the fire service family. Fortunately, many departments have leave policies where firefighters can donate leave to each other when they're undergoing these treatments or need to take time off work. I know of one example locally where I'm from that a firefighter needed some extended treatment and missed a lot of time from work, but he didn't miss one paycheck because that community came together and supported him and were able to cover him with unused leave time to ensure that that wasn't a financial impact on his family. Many turn their struggles into action, again, advocating for awareness. And just like firefighters, families can also experience personal growth, greater resilience, and a renewed focus on health and well-being after navigating cancer. And I really liked this quote that I found, so I left it here. While cancer presents significant physical and mental challenges, many firefighter survivors and their families emerge stronger, more resilient, and deeply transformed. Through resiliency and a renewed sense of purpose, they turn advocacy into growth. They turn adversity into growth, advocacy, and lasting impact within the fire service community. Okay, so just briefly, some action steps. We've talked quite a bit about encouraging early screenings, so promoting those regular medical checkups. Might not even be cancer that's detected at that time. It might be heart disease, like we heard previously, or as we're working to get mental health screeners into some of these preventative screenings, sometimes we can pick up depression or PTSD or other issues early on and be able to treat. These mental health concerns, the vast majority of them are highly treatable. These things are very treatable if we get people connected to the right types of care. So it's important that we're screening early and we're getting these diagnoses early on. Fire departments can provide access to proficient counseling and peer support. It's a critical element. The provision of these services really starts within the fire department, and that's what makes it sustainable. I think programs such as the ones that I work with are really important, and the research is important, but this work has to start at home, and that's the way that we make it sustainable, is through embedding these things into the fire departments themselves and into the fire service culture. Fostering open conversations, normalizing discussions about cancer risks and mental health. That is key. These conversations need to become more commonplace and normalized within the fire service culture. Strengthening peer networks, peer support is the true heart of resiliency, of a resilient fire service, in my opinion. So strengthening those peer networks, advocating for better benefits, promoting healthy lifestyles, and supporting firefighter families. Key takeaways that I've just run through: the intersectionality between firefighter cancer and mental health is yet understudied, but presents a huge opportunity for some growth and development, one that I look forward to continuing after this. The cancer journey from risk to survivorship poses many challenges and concerns. However, resiliency and post-traumatic growth can play a key role in supporting individuals who are anywhere along that spectrum of the cancer journey. Fire departments can support personnel by encouraging those early screenings, integrating mental health resources into what they do every day with their fire department, and fostering open discussions to normalize this concept of you need psychological support if you are going through a cancer diagnosis and treatment and recovery. And including families, again, key element there to be including our firefighter families in this work. Strengthening firefighter peer support networks and advocacy can improve cancer prevention and mental health outcomes within the fire service. So I know I mentioned that this is a new and emerging field, but I did find some resources and wanted to leave those here on the screen. And so there are some really good resources out there. I came across a few through the IAFF. They're doing some good work in the intersectionality between firefighter mental health and cancer. Of course, also Sylvester's resources that they have for their patients and for the community is a wonderful resource. If you're interested in more about post-traumatic growth and what that is and how you do it, what are the steps to get there, you can check out bouldercrest.org. They're the organization that does Struggle Well, which is one of the key frameworks that we use for, we use the terms resiliency and post-traumatic growth interchangeably quite a bit, but they're actually very different, and Boulder Crest likes us to differentiate between the two. So they do the post-traumatic growth work. And with that, again, I will open it up for some questions, and I look forward to continued conversations and work in this important area. Thank you. No questions? All right, thank you.